Welcome. It's August 29, 2023. I'm Dr. Deuk, the CEO and founder of Deuk Spine Institute. We are now getting ready to perform a cervical shot, Deuk laser disc repair on a patient who's here from Texas. Shot. He presents to us from Texas because he has problems with his discs in his neck. He's got two herniated, degenerated discs, C5-C7. He's had a prior fusion. You could see that at C4-5. You guys see that? See the screws in C5, screws in C4, the cage between. This is what fusion does, folks. Look at that cage sticking out. I'm sorry, look at the plate sticking out at the top, right there. The surgeon did not do a very good job. Not much we can do about it at this point. And then he had pain in the facet joint above his fusion. Show us that. You guys still on the x-rays, right? No, one down. Right there. That's the 3-4 facet right there. And we had to do a DPR there on the right side, and now we're going to fix his discs below the fusion. So fusions cause all kinds of adjacent segment disease. Shot. All right, here we go. Shot. Beautiful. You can see the dye in the disc. Show us the tear in the back of the disc. Shot. All right, you guys see the tear right there? There's an annular tear. That's where his discomfort and pain is coming from at this disc. You guys can all relax a little bit for a second. Now I've just placed a guide wire. Shot. And now we're going to do a little injection. We're good. We're good. We're going to put some numbing medicine in the skin. The entire surgery here will be done through a 4mm incision. Tiny, 4 millimeters. We're going to lose more blood from the injection than we are from the entire surgery. All right, there's a 4mm incision. So far we've lost a few drops, but we're ready. Shot. I'm going to take the needle out and leave the guide wire. Shot. Here we go. Shot. Now when I say shot, I'm asking my technologist, Jordan, technologist extraordinaire, to take a picture with the fluoro. The fluoro is an x-ray machine specially designed to take pictures of the spine and joints during surgery. Shot. It allows me to navigate and localize the levels that I'm supposed to treat. Shot. You can see the dilator moving down to the spine, in the front of the spine. Shot. Yep, thanks, Jordan. Perfect. All right, I feel the spine right there. I'm at C6-7. You agree, Luis? Let's get an AP view. Everyone relax. We've lost now about 3 drops of blood. We're going to get another picture from the front. I want to make sure that the dilator is in the front of the spine, in the middle. And there it is. Show us the middle of the spine, Jordan. You can see the spinous process, and this is right where the spinous process is. So we're in the middle. Perfect. Lateral. You can show us the, stay there on the x-ray, Henry and Sanjay. Show us the esophageal temperature probe. Take a look at the arrow. See that braided line right there? That is actually the esophageal temperature probe. So I've displaced the esophagus away from where I'm operating. It was successful at displacing it. Our patients with this surgery don't have any post-operative pain that needs narcotics. These are narcotic-free surgeries. We don't use post-operative narcotics after the patient leaves our facility. Whereas fusions and artificial discs, patients have to take opioid painkillers for months. They get addicted, they get tolerance built up, they can sometimes abuse, and it's really hard to get off those painkillers. They've ruined millions of lives. Almost there. I'm advancing my dilator. Dilator tip is at the back of the disc, and I'm ready to bring my tube in. All right. Yeah, the last patient from Australia we just did this morning, he actually has a has a much harder disc to get into because it was more scarred up. Now this patient has a lot of scar tissue in front of his spine as a result of his prior spine surgery. But he has less scar tissue in the disc. Beautiful. Nice job, Jordan. Go ahead. We're going to place our adapter. I spoke to my son this morning, Arias. He's at Princeton, starting Princeton University. He's at, for those of you who know Princeton, at Maddie College. Maddie is a residential college, one of many at Princeton. All right, Luis, you know what to do. And Maddie, as well as the other colleges, started this last week. We dropped him off. They're doing orientation activities this week. And they don't have air conditioning. So it's hot. They're having a heat wave. And he has no air conditioning. Poor kid. Arias, we all feel for you. But what impressed me the most when I went there is, if you've never been to Princeton, New Jersey, the entire school looks like Hogwarts from Harry Potter. And of course, Hogwarts was designed after Princeton. If you go into the dining hall at Maddie College, which is right behind his dorm room, like literally, the whole dining hall is a giant hall shaped exactly like the dining hall in Hogwarts, with all the students sitting on long tables, vaulted ceiling, Gothic architecture. Incredible. I had no idea where they got that from until I walked the campus and I realized, geez, this is straight out of Harry Potter. No joke. Amazing. All right. Let's show our audience, why do these disc herniations cause so much pain? Let's show them a video explaining how a herniated disc can be so painful. And then we'll talk again after you're done watching the video. Piece of herniation there. All right, welcome back. You could see from our video that the problem with all these disc herniations is actually they make pain through a process called inflammation. And for those of you who have never heard that term before, inflammation is basically one of your body's defense systems. And your inflammatory system was designed millions of years ago, and it is not unique to humans. Animals have inflammatory systems. Fish have inflammatory systems. And these inflammatory systems are basically a type of defense system that relies on a circulatory system. A circulatory system, for those of you who don't know, are blood vessels and a heart that pushes the blood around the body through blood vessels. And the inflammatory system lives within this circulatory system. And the inflammatory system is made up of cells and chemical messengers called cytokines. And the inflammatory system, its job is to basically hunt down foreign invaders that try to come into the body and try to attack your body and take it over. Okay? So what happens when you die is your heart stops and these circulation stops. And then all the bacteria living on your skin and in your gut, they say, ring the dinner bell. This guy's dead. He's got no more circulatory system. Because there's no circulatory system, you don't have a defense mechanism against them anymore. Basically, the soldiers have gone off on vacation, and the enemy knows it. So they start to invade your body. They start to eat through your tissues and munching away, and there's nothing there to stop them, like the inflammatory system. Because your inflammatory cells are paralyzed. They're dead. They cannot move. They don't have the circulation moving them around. They need the circulation, the constant movement and flow of blood to move their mediators, to move their cells around your body and patrol the castle. But when your circulatory system stops, your soldiers can no longer get around the body to fight the invaders, and the invaders know it and they invade. And you get an infection and you rot. And that's why corpses smell so bad. They're rotting. It's all the bacteria and the organic chemicals the bacteria produce called like putrescine, cadaverine. These are odors, the kind of odors you really don't want to, if you're going out on a nice date with a young lady, you don't want her to smell those kind of odors. Or a young man, or whatever it is your preference is. Anyway, that said, the point is, without your circulatory system, you have no defense system. Really no humorally mediated defense system. Now, you may think that's funny, humoral, but it's not. It's not so funny when your body starts to get decomposed while you're... And this, by the way, this happens when you're alive too. It happens in diabetics. It happens in people with poor circulation. They get a little wound on their leg and the bacteria start growing. Well, the bacteria start growing on your tissue. It's called gangrene. And the problem is you have no circulation there, so your inflammatory system cannot go in and attack these fungus and bacteria growing inside your skin, your tissue. All right? We call it gangrene. It's basically a cellulitis, a fasciitis, a myositis. It's basically inflammation of muscle, fascia, skin from infection. It's an infection of those areas, not inflammation, but infection. So that shows you how important the inflammatory system is. Now in a disc herniation like these, you're getting an inflammatory response. Your inflammatory system of your body knows there's a problem. There's a tear, a breach in the disc wall, the annulus. And so, of course, the nucleus starts to come out. And as soon as the nucleus comes out far enough to your outer annulus, your body responds, your inflammatory system responds, because you've got a circulation in your outer annulus. You don't have it in the inner annulus. So what happens then is, because the nucleus pulposus herniation becomes seen in the outer half of the annulus where there's the circulation, blood supply, blood vessels, capillaries, your inflammatory system that's just cruising by in that area looks out and sees, oh my God, there's a nucleus pulposus herniation here. This shouldn't be here. And then, of course, it attacks. By the way, this guy had a foraminotomy. This is the foraminotomy right here. You can see it. He had it done through the back, and it didn't work. And you can see why. There's still a herniation right here, all this blue stuff. This was done by a doctor in California whose name shall be said, Dr. Tony Mork. Tony Mork. Dr. Mork did this foraminotomy in the back of his neck, and now look at all the scar tissue from the foraminotomy. It's horrible. But he left the herniation. I just took it out right there with the blue stuff. I'm going to take out a little more, as much as I can. But really, the foraminotomy didn't do anything for this patient, except make him worse. So what's the message here? Don't get a foraminotomy done. They don't work. There's the nerve root, by the way, right there. You see that? The nerve is just there. And I've taken the herniation now off of it. This is a little more scarred up herniation. Any questions from our audience?
No current questions.
Boy, our audience is just dead today. It's sad. Oh, well.
Oh, we do have a question. This comes from ERMS on YouTube.
Yay! So let's get some applause going. We got a question.
And
finally, some engagement.
They ask, how many times is the disc laser surgery repair cost compared to the traditional discectomy surgery?
All right, look at that herniation that came out of there. That was beautiful. All right, I just heard something about cost.
Yeah.
Is that correct?
Yes. How many times is the disc laser surgery, the DLDR, repair cost compared to the traditional discectomy surgery?
Oh, more herniations. Well, that's a great question, one that I don't know the answer, because first of all, the cost of traditional disc surgery is far more expensive than Deuk laser disc repair. Why, when you factor in the cost of the surgery for traditional disc surgery, that surgery itself is more expensive than the Deuk laser disc repair. Then you calculate the complications that happen as a result of traditional disc surgery. The complication rate is 50%. That means half of the patients with traditional disc surgery are going to have complications. Complications, folks, typically cost at least $100,000 in addition to the cost of the surgery. So you've got that. Plus, with the traditional discs, look at all those herniations coming out that were missed by Dr. Mork. Then you've got the cost of not just complications of $100,000 more, but you've got the cost of lost work, right? Like, people need to work. So with the Deuk laser disc repair, you can go back to work in a few days. With traditional disc surgery, you can't go back to work for like 6 weeks, at least. Sometimes longer if you have complications. Then you've got the cost of the drugs. Like with the disc surgery, the traditional disc surgery, you got to pay for narcotics, muscle relaxers, which Deuk laser disc repair, there's no narcotic drugs, there's no muscle relaxers. It's Tylenol for one night. That's it. So with Deuk laser disc repair, there's no drug cost. With traditional disc surgery, you got all the drug costs. Then with the traditional disc surgery, you've got addiction. You get addicted to drugs. With Deuk laser disc repair, you don't get addicted to drugs because you're not taking any drugs to get addicted to. With traditional disc surgery, then you got to go to pain management for years after your disc surgery. Get shots like epidurals, facet treatments, spinal cord stimulators. So there's the cost of pain management with traditional disc surgery. That's usually about $250,000 to $500,000 in a lifetime, depending on how often you're going. Then you've got the cost of physical therapy with traditional disc surgery. Physical therapy gets expensive if you've been going for like a year or two. You'll spend, easy, another $50,000. right? Then you've got the cost of your interpersonal relationships with traditional disc surgery, like your friends and family being cut out of doing things with you because you're still in pain after traditional disc surgery. So if you add up all the costs with traditional disc surgery, you're looking at easy $500,000 to potentially $1 million. And then of course all that addiction and possibly dying from narcotics and all that stuff. Whereas with Deuk laser disc repair, it's usually somewhere around under 100,000, and there's no narcotics, there's no pain management, there's no need for any of that other stuff, there's no addiction, there's no complications. I think the cost of the traditional disc surgery is about 10 times more on average than the Deuk laser disc repair. These are herniations, by the way. Even though you're right, I agree with whoever wrote the question, the Deuk laser disc repair should be more expensive because it's a far superior technological surgery with better outcomes and lower risk of complications. It's actually less than traditional disc surgery. Far less. Right, Luis? Why, this patient here will go back to work probably within a few days. Great question. Keep them coming. I love those questions. Very insightful. I'm glad you asked, whoever asked. Thank you. I don't get a chance to talk about cost very often, so it's always good when somebody asks me about cost so I can highlight the benefits of this surgery over traditional disc surgery in terms of cost. Oh yeah, and with traditional disc surgery that you're talking about, look at that herniation. There's also a cost of doing more surgery, which when you do traditional disc surgery, you're going to have what's called adjacent segment disease like this, where you got to come back and get more surgery. We don't have adjacent segment disease with Deuk laser disc repair ever. So you're not going to have to come back and get more surgery typically with the Deuk laser disc repair. We have a reherniation rate with Deuk laser disc repair of 1%. That means 1 out of every 100 patients will reherniate. And I can tell you based on my experience, it's always because the patient did something they shouldn't do. Like, I don't know, riding on a roller coaster after surgery, for example. You know, going to a theme park with your family and then getting on a roller coaster and snapping your neck, and then next thing you know, you got another herniation. Well, folks, you can't blame that on the surgeon. You got to blame that on yourself. People do some silly things, even though they know they're not supposed to. All right, I've got just a few minutes here on this disc, and then we'll be done. And we're going to move on to the next one, the number 5-6. But so far, this has gone, honestly, better than I expected. Once again, this patient is from Texas. The next patient, the last patient was from Australia. Patients know they don't want traditional disc surgery. They actually come from all over the world to avoid it. And avoid it they can. Now, of course, if you go to your neurosurgeon where you live, they're going to tell you you need a fusion or some type of traditional disc surgery because that's all they know how to do. At Deuk Spine Institute, we do every type of surgery. We can do traditional disc surgery if that's what you want. We'll do it. If you want a fusion, I'll do it. If you want a metal disc, I'll put it in. You know, in the end, the patient is the one who chooses the treatment, not us. We can only recommend things. In the end, patients have to decide for themselves what they want. After all, they have to live with that decision. So I just ask that people get informed about the decision. Make sure you know what you're getting yourself into. It's the best we can do. All right, just about done. I've cleaned out the entire herniation. I don't see really much left. And I'm going to just check the other side and we'll be done. Flip it. Any questions, feel free to ask. Let's show our video on how the Deuk laser disc repair actually does its job. I think this will be it right here. All right, welcome back, and we're just putting our final touches on this patient's surgery. We have taken out a lot of herniation here, and wow, things are looking good. I don't see any more. There's one little piece there. Float these guys up, and we're done. The rest of these can be floated out. Irrigation. Little betadine in there. We like to put some antiseptic because, well, honestly, it's something that I've just grown up doing. Surgeons like to irrigate their wounds when they're done. All right, if you have questions, feel free to ask. I'll happy to take your questions. We've had some good questions so far. Somebody asking about cost, and I think that was fantastic. So happy they asked about cost, because the Deuk laser disc repair costs you a lot less than traditional spine surgery. Okay, we're gonna bring in the fluoro. Yeah, when you look at the complications that happen with open spine surgery, like discectomy, laminectomy, artificial disc, fusions, foraminotomy. I mean, this guy here had a foraminotomy done. Didn't work. He's having another surgery. We just had to clean up the foraminotomy. He also had a fusion. Didn't work. He's back here having another surgery. People generally do not need another surgery with the Deuk laser disc repair. I think 1 out of 100 end up re-herniating, and they're going to need another surgery. But the rest don't. Shot? We've been doing this surgery now for, 17 years. And our patients that we did 17 years ago, 16 years ago, shot 15 years ago, they're still doing very well. All right, let's line things up. We're going to have to move and slide. This is the Deuk spine slide. I need to see that next disc properly. Let's get a shoulder down, Luis. Shot. All right, that looks really good right there. Here we go. Everybody ready? We're going to come out, and I'm going to slide this along the front of the spine. Shot. Let's get an AP. You want to stay right in the middle of the spine as you slide. There's going to be a tendency for the muscles to push you to the side. You don't want that. You want to stay dead center. Shot. Lateral. One of our patients was so sweet. She told me that Adele, the singer-performer, had to quit her performance yesterday because of sciatica, I guess. Her back. So she's going to try to get Adele to come here and have us fix her back. Shot? I just thought that was pretty amazing that one of our patients, Shot, would care so much.
They'll take great care of her like
Yeah.
we do all our patients.
Shot? That's perfect right there. Let's get an AP. I want to make sure we're right in the middle. Quick, quick. Shot. All right, we're off to the side. Just stay there. I need to move back to the middle. Shot. Great. Now let's go lateral. I need to make sure I'm... Oh, wait, something moved. Shot. So I'm right on a bone spur. That looks good. Go ahead and go lateral. Let's do it quickly, Jordan. Mallet. So I'm happy with my AP. I'm in the middle. I want to get... Oh, I'm happy with the lateral too. That's great. Once again, I'm going to tap in, not tap out. Shot. All right, let's do our discogram. I'd like to try to stain the disc blue. Shot. Shot. Perfect. Let's see what we can get here. Any more questions from our audience?
No current questions.
Yeah, couldn't get any out. Shot. Remember, this is just next to the fusion. You guys see the fusion there? Whoever asked about, yeah, that's good, about the discectomy, there's your discectomy right there. Unfortunately, that discectomy caused this man to have more surgery. Had he had the Deuk laser disc repair instead, he would not be needing this surgery. Great. You guys ready? Everybody ready? We're going to connect, and we're going to advance. I got it. Luis, I got it. Just go ahead and get the jaw. Watch the shot. All right, here we go. I feel it. Shot. It's very good, Dr. Berndes. Your inline traction makes all the difference in the world. Almost there. Man. Almost there. Second patient, we haven't been able to advance all the way. That's about as much as I can do. All right. Good job. Let's get it out. I need a little inline to get Luis to get it out. All right. So far we've lost about, I don't know, maybe a cc or half a cc, a milliliter of blood. It's about 10 drops. This is pretty much bloodless surgery, folks. Little traction. Little traction. Got it? All right, now straight out, gently. No, you're bending again. Straight out this way. All right. So, Deuk laser disc repair, 4mm incision, outpatient, no metal, no cadaver bone in your body, no metal plates, no screws, no cages, all natural. We're going in and repairing your herniation, not fusing it, not doing a discectomy. This is the only place in the world you can get it done at this time, Deuk Spine Institute. There are other types of endoscopic surgery, but none that do an annular debridement, which is essential for getting rid of the neck pain and the arm symptoms when you have radiculitis. Questions? Looking good?
No current questions.
So you can see from this endoscopic view inside the disc, inside the herniation, that there's a lot of this white stuff. This is all scar tissue from chronic inflammation. Okay? This is the annular tear, and right there, there's scar tissue. You see the golden color, orangish gold? That's calcium. within the scar tissue. That comes from chronic inflammation. It's called dystrophic calcification. Like muscular dystrophy, but instead of muscular dystrophy, it's dystrophic calcification. And that's what happens when the laser energy interacts with the calcium. It turns it a golden color. All right, we're almost done. So we're going to be finished in about 5 minutes, doctor. We've already completed our Deuk plasma rhizotomy. That was done earlier. He had a adjacent facet next to his fusion that was really hurting a lot. C3-4. We did that first. You could see that video earlier today if you go back and watch it. This is our second surgery. The next patient is Greek, and he is having a lumbar Deuk laser disc repair for back pain and leg pain. I want to thank my team for doing an amazing job today. As they do every day, by the way. Sanjay, you have any questions for me?
We actually have a question off of YouTube.
All right, bring it.
This comes from Mohammed, and they asked, "Hi, doctor. Hope you are doing fine with your colleagues.
Thank you, Mohammed.
Can exercise cure disc problems?"
No. Exercise will never cure disc problems. Disc problems will feel better on its own sometimes in the early stages of inflammation, but the exercise will never cure a disc problem. Never. I've never seen it happen. The problem, Mohammed, is that there's a tear in the annulus fibrosus. And once this right here is the herniation, you see that? Once that gets inside the tear cannot seal itself back. It cannot seal closed. The only thing that happens at that point is inflammation. Now, when you exercise, it's always good for your body to exercise. What exercise can do is reduce the secondary effects of a herniated disc. So what are the secondary effects of a herniated disc? Well, you get pain from the disc, which then causes muscle spasms. Muscle spasms, of course, are painful. So you can reduce your muscle spasms with exercise, but you cannot ever get rid of the disc pain or fix the disc problem with exercise. It's a physical problem. It's a physical limitation. It doesn't matter how much exercise you do. It's never going to go away. I've been treating it now 26 years. I can tell you the same thing even after 2 years of treating it. I've treated over 100,000 patients with disc problems, and the exercise never fixes the disc problem, never. The exercise was good for you, it's necessary, it keeps your muscles fit and toned and stretched, but it's never going to fix the disc pain. Surgery, Deuk laser disc repair will. This is your best option. Anything else just allows the inflammation to progress and destroy the disc over time. Like this disc right here, there's really no disc left. This patient has no more disc. And then you start getting bone spurs. So if you want to avoid total destruction of your disc, get it fixed while it's early, and the annulus can be debrided with the DLDR, this procedure, and then you can have a disc that heals itself. And then you won't have disc problem the rest of your life. Unless, of course, you re-herniate it. Some people do. They don't take the restrictions seriously. All right, I got 2 minutes. I'm done. Great question, Mohammed. Thank you for asking. This, again, scar tissue here and bone spurs at the back of the disc. But I don't see any more herniation. Beautiful. You can see everything with the endoscope. You know, the surgery is endoscopic laser. It's two things. It's the laser and it's the endoscope. Both of them are essential. You can't do the laser without the endoscope, and you can't do the endoscope without the laser. That's why it's called the Deuk laser disc repair. It requires both tools.
Lights on, please. Thank you. Stop off.
All right, ask your questions if you have any, but we're just about done. We're done, actually. And I'm just going to irrigate out anything left in there. Oh. Any more questions, huh?
No current
I
questions.
couldn't really hear what you said. Everything okay? I'm going to show you the incision, folks. Just watch. It's going to amaze you how small the incision is. These patients don't have any trouble with bleeding. They don't have any trouble with scar tissue. They don't have any trouble with swallowing. They have a little bit of raspiness to their voice because of the endotracheal tube. But aside from that, which goes away in a day, they don't have the problems you see with fusions. Artificial disc, because of big incision, lots of damage inside the body to the esophagus, strap muscles, bleeding and scarring that happens with open surgeries. This is endoscopic spine surgery. This is the future of spine surgery. We're doing it here today at Deuk Spine Institute. We've been doing it, unfortunately, 17 years, and other surgeons don't want to do it because it doesn't make them money. Look at this incision right here. Sanjay, you see that?
Yes, doctor.
4 millimeters, 5 millimeters. See, I made my incision too big. I went 5 millimeters instead of 4 millimeters. Extra millimeter. Just kidding. It's supposed to be a joke. All right. Thanks for joining us. If there's no questions, you can end the broadcast.